Hey, Disturbed listeners, it's time to continue reacting to Dr. Spiegel in the Johnny Depp Amber Heard trial. Dr. Spiegel was hired by the Amber Heard team and is evaluating Johnny Depp from afar. Let's watch. My name is Dr. Kirk Honda. I'm a therapist and a professor. Let's see what happens.
The texting that were involved in this in terms of erratic behavior was disturbing in terms of the verbiage used, the phrases used. Am I free to use some of the language, or should I reserve that, Your Honor?
Go ahead.
I can?
Believe me, the jury's been hearing it.
Okay. All right. I want to make sure. Okay. So it's something along the line that Dr. Kipper is an effing charlatan. He ought to...
Objection, hearsay.
He's entitled to rely on it and he's to give his example.
He's saying that Johnny Depp exhibited this and that. Erratic behavior is what they're going over right now. And I haven't been reacting to it because a lot of it is pretty dubious in terms of how a psychiatrist, I found out he's a psychiatrist, would be able to make that conclusion based on what he had heard.
He can talk about what he developed from the hearsay, but not repeat it himself.
He's entitled to give examples of it.
I'll sustain the objection.
Without giving the exact words that you recall.
Oh, without giving the exact words?
Yeah.
Okay. So, I mean, without giving the exact words, it was basically vulgar language directed towards Dr. Cowan throughout multiple texts, multiple things that Dr. Cowan were doing in therapy. It was, like I say, it was without relaying the exact thing. I'm trying to be as accurate as...
Okay, so again, and I just don't like this. I know you attorneys out there will say, no, there's a good reason for this. Well, speaking selfishly, I just wish that he could provide the examples that he's basing his conclusions on. Otherwise, he's just saying general statements. You know, there were lots of examples that I can't state right now because it's hearsay, where Johnny Depp was exhibiting aggressive, erratic behavior. Well, if I were on the jury, I'd be like, give me an example. I'll take it into consideration that it is hearsay, and I won't take it as if you were there. I think I can differentiate between that. I want to be able to evaluate if his evaluation is credible or not, and he isn't allowed to provide what he's basing his conclusions on. The justifications are there, but it's behind the hearsay wall.
And I think at the end of it, I think he was also talking about that Dr. Cowan was filling Amber with positive thoughts, a therapeutic...
Objection, hearsay.
I think he's keeping it more general, and he's entitled to rely on. Thank you.
Yeah, so what Dr. Spiegel is saying, I believe, is that Johnny Depp was ranting that this other clinician was believing Amber Heard's lies and was even encouraging Amber Heard to believe certain things that just weren't true. And is that possible? Yeah, it is, given everything that we've seen. I'm sure many of you believe that that is possible, that when Amber Heard was going to individual therapy, that she wasn't completely truthful or was so distorted that she didn't have a grasp on the full landscape of their relationship and would only speak from her experience. Certainly the 3-6 minor spike, and again, that's another issue that we don't even know. Like, what was the T-score anyway? Could we believe that Johnny Depp would conclude based on enough information that the clinician and Amber Heard were going down a road to persecute him in an unfair way? Sure, maybe, or maybe not. Maybe Johnny Depp had no basis to say such a thing, and Amber Heard is the victim of his intimate partner violence. Now, he had access to all the information, so I'll give him the benefit of the doubt that if I had access to that information, I might be convinced.
So, more along the line of giving Amber psychiatric jargon to put on him, and actually what I read and interpreted what Dr. Cowan's was getting blasted for was he was kind of teaching Amber how to use conflict resolution in a more appropriate manner and learning to express things more rationally.
Yeah, I don't doubt that. It's not uncommon. So what he is saying is that he thinks what was happening with the clinician, Dr. Cowan and Amber Heard, was that as Amber Heard was presenting conflict at home to Dr. Cowan was advising her on how to use more differentiated language, more calm language, more accurate language, such that you can actually work out the conflict. That's typically what therapists will do. I will say I know from experience that some therapists won't. They'll just conclude that the partner is this jerk face when there's another side of the story, and we'll just say, well, your partner's narcissistic and all these kinds of things, and it's not a helpful perspective. And some clients will even email me, people that have been in therapy, and will say, I would complain, but my therapist took it too far and seemed to really hate my partner. And I was like, what are you doing? I think do you have an issue in your life that you're imposing here? Which, happens and could be true. But anyway, so Dr. Spiegel is saying that Dr. Cowan was saying to Amber Heard that it was, he was trying to help and not say, you should tell him that he's got a problem. And is that possible? Yeah, that's probable. Could Amber Heard walk away from those conversations and pick out as much ammunition or even just invent it and throw it at Johnny Depp by saying something like, well, Dr. Cowan says that you're narcissistic or something? Absolutely. That given the things that they said to each other, that would be low-grade psychological abuse. We've also heard Johnny Depp saying to her on recording, you're borderline, essentially, which is kind of along those lines.
Being sworn at. So again, erratic behavior in terms of writing a text, but I have no problem with people being angry. Okay, none whatsoever. It's just the expressing of it and the continual ranting of it was very uncomfortable for me to read. But regardless, I think we have seen in terms of erratic behavior, much of the psychological and the physical maltreatment we talked about.
Objection beyond the scope of the.
Yeah. Do we believe and do we have a lot of evidence showing that Johnny Depp was extremely hostile and verbally abusive over texting? Yeah. I mean, it's all there in black and white. It's in the text record. Now, maybe you could argue, oh, he's just joking. It doesn't really mean. It's hard to imagine that that's true, but especially given even his own accounts. But was Amber Heard also verbally abusive? There's recordings where she's being verbally abusive, or at least that seems to be the way one would characterize it reasonably. So on one hand, it's like, okay, what he's saying isn't counter to the evidence thus far, but at what point are you going to include, is Amber Heard completely devoid of any kind of responsibility? Did she ever do anything that was equally as abusive?
So people have used it off-label, physicians have used it off-label to help them sleep. The problem is the effect is very barbiturate-like, and it really knocks people out, or certainly if you use it at high enough doses it can, okay? And the problem is it also has street value. So it's absolutely used on the street for that downer-like effect, and obviously it's a little bit more readily available because it's prescribed.
All right, so they're reviewing the Seroquel prescription. I don't know. I wish we knew how often he took it. I'm going to assume that he was taking Seroquel every day to fall asleep. I don't know that, obviously. I'm going to assume he was taking benzodiazepines every day to calm his nerves. By the way, benzodiazepines and alcohol can work together to suppress your nervous system such that you will stop breathing and pass out and die. So be very careful about all those substances. Always talk with your physician about it. So I'm going to guess that he was. And yeah, if he was taking Seroquel every day, depending on the dosage, depending how it worked for him, yeah, there's side effects to that as he's describing. But, we don't know. We don't know if he had major side effects. We don't know how often he took it. We don't know if that affected things. We don't know if that affected his behavior or his memory. And I'm glad he's on the stand actually explaining all this stuff, because the pharmacological picture regarding Johnny Depp is really quite elaborate and confusing. And so, he's pointing things out, and I'm guessing, this is a good call by the Amber Heard team for him to throw out these possibilities to, create doubt in the jury, because it's viable doubt. The jury would have viable doubt about not only Johnny Depp's memory, but also his behavior, given all the directions his nervous system was being pulled, because sometimes he'd be using these substances, and it's, it does create some questions. But does it throw it into question for me significantly? Not really, because the audio recordings say a lot, I think, in terms of a glimpse into their behavior. The witness accounts.
What you will see in patients who have substance use disorders are people who unfortunately kind of wake up and fall asleep only through pharmacological assistance, meaning that their own circadian rhythms are no longer in control of that behavior.
Absolutely. And given all the substances he was taking, I don't doubt that that was true for him. I don't know that. But given everything that he was taking and given, because I think he was also on stimulants, which he might have been taking to wake him up in the morning. And this is a danger with using even prescription drugs to modulate your circadian rhythm, i.e. fall asleep, that kind of thing. And I've worked with people that have had this issue that their circadian rhythm doesn't operate normally, meaning that they can't fall asleep or they can't wake up unless they take these substances. And of course, the substances have side effects. And they're talking about Seroquel and how that can have a lot of side effects. Absolutely. So it's just advice out there. I'm not a medical provider, but you should be talking with a medical provider, because sometimes your medical provider doesn't know this or doesn't pay attention to this, and they'll throw, pills at you because when all you have is a hammer, everything looks like a nail. In fact, oftentimes what is recommended when you actually talk to sleep experts, that they will say, whoa, like maybe the med will help, but overall, that's not the long-term picture that we want to go down with these people, because we really could, one, be locking them in on needing that substance in order to fall asleep, which we don't want because of the side effects that will pile up over time. And two, those substances can make you pass out, but not necessarily give you rejuvenating sleep. Often, as a general rule, it's best when you can actually sleep without any substances that interferes with the cycle of sleep. In the United States, we have this culture of there's a pill for everything. I feel like we're maybe pulling out of that a little bit. I don't know, but it could be getting worse. And there's this idea of just like, oh, I can't sleep at night, pill. Oh, I can't wake up in the morning, pill. Oh, I'm having trouble with this thing, pill. Yeah, sometimes pills are great. And, take it from me, I've worked with a lot of people where pills and compounds within those pills can be absolute life savers.
Spiegel, what effect would this have on Mr. Depp based on the dosages he was taking?
So I think what you're looking at is
objection, speculation.
Yeah, that's a good objection. You can't say based on a dosage about that exactly what effect it would have on someone. That was a bad question by the lawyer. She should have said, given your clinical experience, knowing the dosage that Johnny Depp had been prescribed, what would be typical? That's a much more answerable question.
Overruled. Please continue.
What you will see in patients who have substance use disorder.
So the judge overruled it. Now, maybe this is some sort of expert testimony leeway of some sort, but to say, I know, and now he's not answering the question that way precisely, but the way the question was asked, his response would imply, I know what effect it had on Johnny Depp, which of course he couldn't know that.
So Neurontin is actually an anti-seizure medicine, which I think it's indicated for seizures, and it might be indicated for one chronic pain condition, although I can't swear that to you. That said, again, in a substance use disorder population, it has significant street value, and people who misuse opiates often supplement that with Neurontin because it has this anti-pain calming effect.
Okay, so he keeps mentioning that this medication, Seroquel, Neurontin, they have street value because they have similar effects to drugs that people will abuse. Heroin being one. He's saying that, I think, because he wants to provide the notion that possibly Johnny Depp was using these substances not for their prescribed use, but to abuse them, to just have additional ways of being intoxicated in the way that he wanted to be. Is that possible? Absolutely. Do we know that? No, we don't know anything about that for Johnny Depp. He could legit be addicted to opiates, as he has stated, and absolutely be on the best prescription and be getting very sound good medical advice and consultation and treatment for things that he would be completely dysfunctional otherwise. Who knows? But if you presented to me a case in which someone had the history of Johnny Depp and the statements from Johnny Depp, and I saw all of those prescriptions, as I've said before, people that know anything about chemical dependency be like, whoa, like we have to take a look at all of those things, because just because something's prescribed doesn't mean it isn't part of the addiction.
Objection. Okay. Again, what it would do is have the street value of using it with the opiates. The advantage is you're using with opiates, and it's because opiates in general, despite everything else it does, are calming. And you use it with it, it offers further calming, which is why doctors have been warned not to prescribe medications like gabapentin and opiates together unless under significant, strict following, because it can cause serious problems.
Right. I've been thinking that as well. I don't have all the information that he has, but given the little bit that they've said even prior to him testifying, I was beginning to wonder, because often when you do, particularly a polysubstance abuser, they will seek medications from wherever they can get it, including prescriptions. So now it doesn't mean that they're evil. It just means that Johnny Depp, my conceptualization of him is that he is suffering from a lot of childhood trauma, and the substances help him to cope, and he doesn't know or hasn't been told or is afraid to actually do trauma recovery that will make it so he doesn't need substances to cope. So it's not an evil thing that people do this. It's out of survival, and it makes me sad that people feel like their only option is to destroy their mind, body, and soul as they try to just get through the day from a condition that was not their fault. He was abused growing up. Obviously, it's not his fault. But the other thing to speculate or wonder about is the wisdom behind the prescribers prescribing him all those things, even though he was taking opiates. He could have died. He could have been one of those individuals, famous or not famous, who just takes too many of these kinds of substances, and not because they're trying to take a lot, but they, just in all of the ups and downs of one's day, they just take too much, or their body is different that day, or they take some other substance, or they don't eat enough, or something happens and they fall asleep and they never wake up, which, by the way, if you're a spouse or you are one of those people, you have to take a tremendous amount of care. I've worked with people like this in the clinic I worked at. There were people who were active heroin users that were not at present trying to quit, but we were doing precursor treatment so that they can at least begin to develop their relationships with the clinicians such that when they are ready to quit, they have those connections. Also, there was a lot of work on making sure that they use to minimize the risk of death. I had a client who I was doing this kind of work with. We had a session, it was psychotherapy session. She was being treated also for a group substance abuse treatment and maybe even individual substance abuse treatment as well. So, the clinic was providing a lot of services to her. She walks out of my building and collapses, and someone saw her. The ambulance got there, and in Seattle, there's a fair amount of people who suffer from opiate heroin addiction, and the first responders recognized the signs of that and administered medication to save her life. And I didn't even notice. It was outside my building. I didn't even know what happened. I didn't hear anything. And she comes in the next week and she says, "Oh yeah, you must have seen." I'm like, "What?" And she tells me, and I'm like, it just, it's frightening.
Already misusing cocaine. Okay, you're now doubling your stimulant dosage here. And basically, what you are talking about, again, it comes down to in the substance use disorder population, you are using it to stay awake, have energy, keep yourself going, getting high, getting energetic.
So they're talking about the Adderall prescription, and he was saying that it can be a problem if the person is already taking a stimulant in illegal form, cocaine. And I remember that that disclosure was early on in the trial that he was taking some sort of psychostimulant. And by the way, just a reminder, I've recorded several reaction episodes, and they're scheduled, but I'm posting this because this testimony was, and I think people are interested particularly in what I would say to a psychologist expert witness or a psychiatrist expert witness. The episode that posts later on, I might be saying things and you're like, I thought he just watched this. The timeline is all very strange at this point for me. But so could Johnny Depp have been using both Seroquel as an additional opiate-like drug? Could he be using Adderall as an additional cocaine-like drug? Possibly. Could he also legit suffer from ADHD and a legit insomnia problem or sleep problem that absolutely justifies the prescriptions? Absolutely. We just don't know, because I don't think he even has those data.
So jealousy, rapid mood changes, poor self-control, and to some degree, condoning violence to a certain degree. When you combine them all together, you get this disinhibiting euphoriant effect from cocaine and Adderall. Then when you combine the two together, what happens? You get too much, and then you start getting irritable. You start getting agitated. Okay? You start becoming suspicious, jealous, potentially disinhibited.
Yeah, absolutely. All this is correct. Absolutely. Drug abuse, particularly at Johnny Depp's level, is absolutely associated with intimate partner violence, but it doesn't mean it's automatically happening at all. But it does raise the risk for sure. Absolutely. So one way to conceptualize this is that with previous partners, Johnny Depp, his previous partners were saying that he wasn't violent, and so it's like, well, Amber Heard must be lying, or that's a piece of evidence against Amber Heard because there's these other partners that were saying he didn't do it before. It's possible that his drug use got particularly out of control during his relationship with Amber Heard. I don't know that, obviously, which could have pushed him over the edge into violence.
Psychotic, and these are the risks. And again, we're talking about not your average everyday use of these substances. We are talking about chronic use together. And we also know that alcohol and cocaine use independently increase significantly the risk of intimate partner violence. These aren't statistics I'm coming up with. They all depend, anywhere from reports up to 7 to 27-fold. So you are, quote unquote, colloquially playing with fire when you are talking about substances and intimate partner violence.
Yeah, absolutely true. Absolutely true. Now, Amber Heard used a lot of substances as well. I don't think not nearly as much as Johnny Depp was. But, alcohol, as he says, is massively associated with an increased risk of being a perpetrator of intimate partner violence. So, they both drank a fair amount. Again, I think Johnny Depp drank a lot more. But, I think it's good to point this out, and he's not saying, I know Johnny Depp did this or that. He's just saying, look, this is my experience. This is what the research shows.
Obviously, there was tolerance and dependence for the amount he was using, because if anyone is naive to these medications, most of us would be dead. Unsuccessful efforts, difficulty cutting back, using more than intended, giving up social, occupational obligations because this. I know there was right after the rehab on the island in Australia when Mr. Depp went out partying with Marilyn Manson. And
Objection beyond the scope of the question.
Actually, that's asking for the record evidence for this.
Sustain the objection. Next question.
Okay, so he is saying that Johnny Depp does meet the criteria for substance use disorder, and here are examples that I know about. And I don't know. Like I said from the beginning, it would be hard to believe that Johnny Depp did not suffer from substance use. I'm just not comfortable typically diagnosing people without talking to them. But of course, in forensic psychology or forensic psychiatry, you do what you do. Now, some of the examples are clear, the withdrawal and the tolerance. That alone, just those two alone, qualifies you for a substance use disorder, at least mild, right? And then, of course, there's likely other criteria being met, but it's hard to know. Like he gave one example that he said that the fights, so he said one of the criteria is that it impacts your life in a negative way. And he says, fighting with your spouse is an example of that, and Johnny Depp was doing that. But that implies that he knows that the fighting was caused was at least in part caused by Johnny Depp's use of substances, which we can't know that for sure. Could you be strongly suspicious that were true? Yeah, but I just want to draw that line that was there withdrawal? Was there tolerance? Absolutely. That he reported that himself.
Psychological, using despite the fact it causes known psychological, psychiatric, or medical effects. And I think that's been pretty well documented. So in this case, you're talking about someone who has a severe substance use disorder. I do want to emphasize, ladies and gentlemen of the jury, that intimate partner violence and substance use disorders are two scourges in this country. They're two plagues. This is very serious stuff we're playing with. And when you are just getting someone closer and closer to the threshold.
Objection, Your Honor. Relevance.
Yeah, it's not really relevant. It's a scourge in our, I guess where he was headed was when you have Johnny Depp playing with fire in that he has maybe a predisposition to be violent, and you add substances to it, you're essentially neglecting your human responsibility to not play with that fire. But again, I don't know if we know enough to say that the substance use disorder was a factor in the allegations. We don't even know if the allegations were true, right?
Mr. Depp injuring his finger.
So I think the physician before me explained that pretty well, but I'll tell you that Mr. Depp has a history of self-injurious behavior, meaning cutting himself. Mr. Depp has a history of burning himself. I know when the actual event happened, there was texting to Dr. Kipper, paraphrasing, not saying exactly, that Amber and him got into a disagreement related to her wanting him to be sober, and then as a result of that, he said he got so angry he cut the tip of his finger off. So if you're asking,
all right, so he is saying that Johnny Depp, because of his drug use and according to his personality and his pattern, that he would often injure himself. Yeah, we don't know. It's possible. It's certainly possible. But I think the most indicating evidence, because it's his story against hers. She will say he did it to himself. He will say she did it to him. No one was there. I guess we would have to wonder about plausibility that he would take a bottle and do that to his finger. It's possible, but it's not typical. In order to have that injury, he would have to take that bottle or something with a lot of blunt force and just smash the end of his finger. Now, could it have been an accident? Yeah, I mean, there's all sorts of things that could be happening, particularly with how volatile they were. He did exhibit behavior of self-harm or of threatening to do that with the knife. The more I think about that event, I think that was probably heavily drug-induced as well. I don't know. But the most indicating evidence was the audio recording that can't lie, right? I mean, it can mislead for sure, but it's factual. This audio recording exists where Amber Heard is saying, I can't remember the exact verbiage, but she's saying, I didn't mean to do that. I didn't mean to hurt him. And I don't know. That tells me that she did it. I mean, why would she be saying that? I guess according to her and her team, she would say that I was hysterical, I wasn't thinking straight, I was traumatized, I was taking the blame, I was not talking about hurting him physically, I was talking about hurting him emotionally because I was trying to get him to stop drinking, and then he took his own finger off, and I felt like it was my fault, and so I was saying, I'm sorry, I didn't mean to hurt him. I don't know. It seems dubious to me, but it all depends on what the jury thinks, right?
Similar risk factors of, burning self and cutting self. I'm not going to get into the descriptions, but it has seen people do a lot worse than that.
Okay.
Yeah, absolutely. Burning self, cutting self. I've never heard even of a colleague telling me of a situation where someone took a vodka bottle and smashed the end of their finger. Now, could that happen? Absolutely. I mean, people will do all sorts of things, particularly if they're highly intoxicated. So there's that. It also, again, could have been an accident. He could have been, I don't know, aiming for his hand, but then was trying not to hit his hand, or who knows. But because it wasn't a slice, it was a smash of the finger. The way it was described, the injury was just. Now, I didn't hear the physician that they're referring to just before this, so maybe there is evidence that somehow it was more potentially severed by Johnny himself. I don't know.
Or subsyndromal post-traumatic stress disorder along the lines of Bader-Weiss syndrome. And some emotional unpredictability. And again, you are a victim here. You are a victim.
Do perpetrators typically seek treatment or counseling?
No, perpetrators are not receiving counseling treatment. One, because they're going to be probably having to tell someone that they actually struck someone, which is what their thought is about the big problem.
So maybe he'll clarify this, but perpetrators have absolutely come to me and will seek therapy. Now, they might not immediately admit to the perpetration of the intimate partner violence, or they might not identify as an abusive individual, but sometimes they do. Sometimes people will, and I don't specialize in that. I did in the past, or a section of my practice involved treating perpetrators, but it's not on my website or anything. I'm not asking for those kinds of clients, and I don't think I'm known for that. By the way, it spans all genders. People will come to me for various reasons, and I will identify them as potentially being abusive, and we'll have a conversation about it. Sometimes it's couple therapy, sometimes it's individual.
Intimate partner violence is just the hitting. Again, important, but not the sole part of it. So perpetrators very rarely will go into any type of formal counseling. Victims go into counseling.
Good. So he said very rarely. Well, I think it depends on what we mean by abusive individuals. So there's that question. I don't know exactly what he's referring to, but there are a lot, as we have talked about a lot on this series, there's a lot of different forms of abuse. And you can have minor abuse and severe abuse, and you can have different forms: physical, emotional, verbal, sexual, economic, these kinds of things. So abusive behavior is pretty common, particularly people who have a lot of relational traumas, who grew up in families where abusive behavior was normalized. A lot of those people will seek therapy, like I said, not necessarily because they say, hey, I need your help because I'm an abusive individual. But, scenarios that I can think of off the top of my head, someone might come to me and say that they're in a lot of conflict with their partner, and their partner's in therapy, and they think that they have an anger problem, and they wonder if they're abusive, and they've been that way for a long time. They don't know what to do about it. They're about to lose their partner. And I've worked with abusive people who would fit the quintessential definition of abusive individual, and again, they're seeking therapy voluntarily. They might be highly suggested to by their partners, but they'll enter therapy willingly. But there's more people who will come in for a different reason, and after investigating in all of the various different things that I talk with people about, I will discover that they are indeed being abusive. And it's usually not physical at that point, because usually the individual will at least suspect that maybe there's a problem there. It's usually verbal, emotional, potentially sexually. And that's harder for people in the lay public to identify in themselves, because especially if they grew up with that behavior, especially if they grew up with a lot of physical abuse growing up, they're like, well, I'm not physical with the person, so I'm not abusive, when they're doing everything else. All right, well, that does it for that episode of Psychology in Seattle. Everyone out there, please take care of yourself, because you deserve it. You really, really do.